Welcome to The Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm your host, Dr. Andrew Wilner. But before we get started, I'd like to thank our sponsor, locumstory.com. If you're considering locum tenens, either full time or on the side, you probably have a question or two, or 20. Fortunately, locumstory.com has the answers you need. It's packed with unbiased information and advice from physicians. Locumstory.com has nothing to sell. It's simply an information resource. You'll find super handy tools that let you see locums trends for your specialty, compare different locums agencies, and there's even a quiz to help you decide if locums is right for you. Locumstory.com is the perfect place to start if you want to learn more about locums. And now, without further ado, I'd like to introduce my guest, Dr. Shereef. Welcome.
Thank you. I'm happy to be here.
So, Serene, you have been a locum tenens doctor, and you have an interesting story to tell about how you came to be where you are. So, tell me first, what are you doing now?
I am doing part-time and with a direct contract with a hospital.
Okay,
And I
part-time
do
what?
still
What are you doing
I do
part-time?
trauma acute care surgery.
Trauma acute. So that means, where I work here in Memphis, Regional 1, it is the trauma center for 200-mile radius. And, I try and stay away from there because there's a lot of movement, right? So as a trauma surgeon, you have to be there like now, like right away.
Correct. Yes. So we actually take in-house call. I work at a level 2 trauma center and we are in-house while we're on call. Because our response time, if there is a trauma, has to be pretty much immediate.
Right. So for neurology, we talk about time as brain, but when the artery is like pumping blood out, like seconds actually
Yes.
matter, right? But I understand you have three children. So somehow that seems a little incompatible just on the face of it. Is that incompatible?
Actually, I would say that my work-life integration now is the best that it's ever been, as opposed to full-time practice and a variety of other things that I tried before I came to my current position.
So trial and error, it sounds
Hmm.
like, got
Yes.
you. So let's go back then. So you finished you start. Where do you want to start with this journey? I'm not sure when the children showed up or when you decided that, oh, I've got to be a trauma surgeon. When did that happen?
Sure. And I would say that as you're going to hear my story, you're going to hear a lot of trial and errors along the way. I did want to just acknowledge, I wish that I had had a resource like you were sharing earlier, because when I started, I really had to piece together the information myself. And there weren't a lot of places for me to compare. So it was a lot more time investment to figure out what locums might fit for me. Is locums even a right option for me, et cetera. So I think that that's helpful as a resource for people. So really my story just kind of started with experiencing burnout through part of residency and then in full-time practice. And I trained at a very intensive general surgery program. We did a lot of trauma acute care. And honestly, I never wanted to do it again. I was like, no, I've done enough to last me a lifetime. And I don't think this is what I want to do. I was very interested in the acute care part. But one of my concerns were that if I did do trauma acute care surgery, how would that really affect my home life? Will I have time flexibility, et cetera? And where I did my training too, our trauma surgeons were there all the time. It appeared as if they had no life. So for all of those factors, that was sort of really bottom of my list. And then what happened was so that was an academic program. I did 2 years of, bench research, the whole deal. And then I decided, oh, no, I'm going to do private practice. So I did a few years of private practice and realized that I like being part of a team and I wanted to be at a place where maybe a little bit a little bit more community-based setting, et cetera. So then I switched and I tried community-based practice. So now I've tried like 3 different practice models. And through this, I had 3 children. I had one child during medical school, one in residency, and one in practice. So I've had the gamut. And when I was in practice doing the community-based, at the community-based hospital, they had trauma in addition to acute care. And I said, by that point, my residency memories had faded a little bit. And I said, oh, I think I could, that's fine. I guess I'll take that as part of the job. And I realized that I really did enjoy it. I enjoyed the mix. I did both elective practice as well as trauma and acute care surgery. And in my elective practice, I did a lot of oncology, hernia surgeries, robotics, et cetera. So I had a very full spectrum of practice. I enjoyed my job, but as you can imagine, with a practice like that, I really didn't have much of a life. And at that point, I had experienced enough to know that it's not going to change if I go to another hospital or try another practice model. I considered locums at that time, and there were really just not great opportunities to fit what I was looking for, because I really didn't want to travel too far from home. I wanted to be able to do smaller, like shorter shifts kind of thing. So that wasn't an option, but my job was kind enough to let me try maybe taking some, cutting down my hours. And so I experimented with that. And I tried a lot of different ways to bring some ease into my life. Because by that time, I think burnout was pretty bad. And I was really not happy. I felt pulled in so many different directions. And I wanted to do what was right for my patients and for my workplace and for my family. And, and it was just not possible to meet all of those conflicting needs. And I started feeling like I was like, one of those like tug of war things that get pulled. So about that time, my children started struggling a lot more at home. I've always had a full spectrum of help at home, because obviously there's no other way to do this. So I've had nannies, I've had multiple babysitters, like all of the multiple components for support at home. And they were really struggling. My oldest at that time was in his early teens, and my youngest was about 4. And to the point that I would come home and, there's tantrums and tears and just general struggle. And I started wondering, what am I doing? Like, what am I actually doing in my life? And what do I need to do? Because I have already done the max that I can where I am. There's no other, adjustments to be made there. So I went in the next day and I handed in my resignation letter. I had no idea what I was going to do, but I just knew that I had hit the rock bottom where I was, and I needed to sort of reset my life and figure out what I wanted.
So
So,
work-life balance.
mhm,
It wasn't
yeah.
balanced.
No, it was like the most unbalanced. It was, I was miserable. I felt like everyone around me was miserable, and it just wasn't, it just wasn't really what I thought I was going to be doing, or where I would be as far as being able to find that integration and balance, especially when I felt like I was really trying my hardest, my best. That there was nothing more I had to give.
So you enjoyed your work. You loved your work.
Yeah. Well, at that point, I hated. I would say it's fair to say I hated everything. I hated coming home and I hated going to work. There was no other place. So but I recognized that it was a factor of just, again, too much, too many things pulling, and feeling like there was no more space to give. And so when I resigned, to be honest with you, at that time I had no idea what I was going to do. And one of the things that I was told is, well, this is it, if this is the best it's going to be. So if you are if you're quitting, if you're resigning, right, then that means that you're not going to be a surgeon anymore. And so that was a very difficult realization. And space that I had to really, even investigate in my head. I mean, is this what I want? Because I did love being a surgeon. I just didn't want to work those many hours in a way that I felt like I had no time or energy to do anything else in my
Let
life.
me ask you a question. Now, a few weeks ago, I interviewed Heather Fork, and Heather is a coach. And a
Mhm,
lot of physicians come to her when they're in that situation.
mhm,
It's like, I'm doing what I think I should be doing, but it is not working. And I don't know if I
mhm.
should leave medicine altogether. For example, did you consider non-clinical careers at that point?
So, I did consider non-clinical careers at that point, but the again, finding something that fit my location needs and my flexibility, that was hard. I considered locums at that point. So there were many things that I considered even before I had made that, call that I was going to resign.
Did you have a
Um
coach? Did you
I
have a
did have a
coach?
I
You
did
did
have a
have a coach.
coach. Yeah, I did have a coach, but it wasn't a career or a personal coach. So I actually started getting coaching through two other avenues. One was through my insurance. So there are some insurances where they'll give you, you know how you get extra points if you do wellness activities, and
Yeah.
coaching was one of them.
Wow.
And yeah, it was amazing. That was the first time I had a coach, and it was covered by insurance. In fact, they gave me extra points for doing it. So I was like, oh, it's like a win-win. So I did that, and she gave me enough of a worldview to know that I was truly miserable and to know that, I had hit that space of no return. Like there's nothing more I can do where I was. So it was helpful, but it wasn't, it wasn't a very in-depth. It was really meant more to be like a health coaching or a like a generalized wellness coaching. Then the other space that I explored was because I thought the big problem was parenting. So I went to a parenting coach and I started exploring, okay, how do I become a better parent? Because maybe if I'm a better parent, maybe if I do, like can connect with my kids even in that those short hours that I'm home that they're awake, then maybe there wouldn't be so many tears and struggles at home. And that also was helpful because it helped me realize that I was already doing a fine job as a mom. It wasn't because, I was a terrible mom or I wasn't showing up or any of those things. What I was really struggling with personally was that I wasn't living congruent with what my life vision was.
Which
And
is
it
what?
took
What did you want to do? What was your
well,
vision?
yeah, what I wanted to do was I wanted to practice medicine in a way that still allowed me time to do things, other things in my life that I cared about, including being present with my kids, but also maybe, time for myself, me having time for my own fitness and nutrition and things like that, having time to do things in the community that are important to me, etc. So really, it came right down to time.
But that's
There's
not the traditional model for a
Mhm.
trauma surgeon,
You're right.
right? Right?
It's not. Yeah, absolutely.
So
You
is it
know,
possible to do both?
absolutely. I'm living proof you can. So the first thing I would say is whatever people tell you is not possible. It's actually just it's not true. And through this journey, I have met so many amazing individuals who have really very creatively found solutions to what they want to do and still practice medicine in a way that fulfilled, I mean, they were able to do both. Now, I'm not practicing full time. So could I do more within, my career? Could I like publish or could I do research or could I do, teach? Like when all of those things are possible. And I think each of us, we really have to explore what is it that we want in our life? What are the things that are important? And now how do you create that in a way that is meaningful and reasonable?
So
So,
describe to me now your typical day. All right, it's Monday morning, 7 a.m. What happens?
well, every day is different. And over the last 5 years, I have done a full spectrum of like, different types of locums. I've done just general surgery. I've done trauma acute care. I've done actually some elective practice and things as well, which I do miss, that I'm not doing that, but it was a trade-off. And I think, for me, the trade-off was worth it. So again, you have to kind of think,
Well,
what's important for you.
since we're talking about locums, tell us a little bit about the locums experiences. How did you
Uh,
find these positions? And did they pay well? Were they fun? Did you hate them? Did you love them? Were you away from home too much? What was the sort of takeaway?
so the best thing about locums is if you hate it, you don't have to go back.
Okay.
So it was actually easier almost to go into something with really no expectations. You're going there to help the other, the surgeons who are there have a break. You're going there to help fulfill a need. And so I felt like the most favorite person in the hospital when I was there, because they really, we were their relief, or I was their relief. So I was very much valued. I think that was a shift. From some of the employed model. One of the things that I've struggled with is that it's like the honeymoon phase. Once you're employed and you're there, then, somehow like every year the value seems to keep going down. So,
Right.
anyway, so
I wanna second that. It's when I worked locums, I'd show up, it's like, "Hello, I'm Dr. Willer." "Oh, Dr. Willer, it's great that you're here." And I figure, well, it's because of my wonderful reputation, but mostly it was because they really needed someone. And as long
yeah,
as I was breathing, this was great, right? And I've heard that
absolutely.
from other locums doctors that
Hmm.
you walk into a place and all of a sudden you are valued. That's the word you
Hmm.
used, and appreciated. Whereas, when you're conventionally employed, there's sort of, well, maybe taken for granted a little bit
Yeah.
year after year. So it
Which is
is an
really sad.
experience.
I mean,
Yeah.
I know it's the culture, and it's the culture everywhere. So it's not, one unique place, but that's kind of sad, because I think that if the employed physicians were valued and they felt like, they had some autonomy and, all of the things that we talk about, right? I don't know that there would be such a need for locums. But there is so much. I mean, every place that I've been to, there's been such a high need, because even in trauma acute care surgery, there's such a high need, because there's, I mean, there's such turnover. And some places struggle with it more than others, but it's, I mean, I've done locums in Oklahoma, Indiana, let's see, Ohio, and now I'm in Virginia. So everywhere it's the same story.
And
If I wanted to work every day of the month, I mean, honestly, there's a need for that.
so, how many days a
So
month do you work as a physician?
it varies, anywhere between 4 to 10, 12 days. I think 14 would be considered maybe full time. Like when I talk to the full time surgeons, that's, 14 to 16 shifts is
Well,
what they do. So
24/7 kind of.
So we do where I am, we do 12-hour shifts, but then we also provide backup care at some point if you're on call during the day. And it's really a great model. I think that there's definitely enough time built in to avoid that burnout factor. It's not perfect, but no
Some
places. So
physicians are concerned that if they work locums part-time, they're not gonna earn enough. Has that been an issue?
not for me. No. So the main thing is considering, could I make more money if I worked full time? Absolutely. But when I look at the quality of my life right now, the ability to do what I want to do, and being able to still practice medicine in a way that is meaningful for me, I think what I make is perfect. It allows me to do all of those things.
What about when you come home? Is there still a lot of crying?
No, because they know that I am home obviously a lot more than I was before. And I think the biggest difference is before I carried my pager or it's really the cell phone. We don't really carry pages as much anymore. So but I was always connected. They could always call me back. There were, things that I needed to address, and also I'm exhausted. So the quality of my own presence is very different. Whereas now, I think my oldest is now 17 and my youngest is 9. And the relationship that I have with them individually is amazing. All three of them, including my 17-year-old, they find time to come and talk to me. They want to know how I can help them, the things that they struggle with, they have also matured in the way they manage it because of the conversations that we've had and the ability and time, really. You can't, I mean, if you don't have time, you can't do any of these things, but the time that they know I'm always there for them. This year, I'm actually going to be homeschooling, or we just started. Today was our first day. We just started. I'm going to be homeschooling my youngest. And in 2020, I actually homeschooled my then seventh grader and second grader. And I would never have been able to do that if I was obviously a full time trauma surgeon. So I think the flexibility in supporting my children in a way that is meaningful to me and to them has been amazing. And with locums, the beautiful thing is you really can do as much or as little as you want. And so I know that, if at some point they're all going to grow up and they're not going to need me anymore. And if at that time, if I want to work more, that I haven't closed any bridges or doors. I can shift and pivot as I need to in the future. So this is perfect for what I need right now.
Now, what would your advice be to a young woman who's graduating her general surgery residency and looking for her first job?
Um, that's a good question. So I would say to find a job that fits the practice model that you like. And recognize that there is, I know that the model was that, you found a job and you were there for 30 years or 40 years and then you retired from there. And so I felt a lot of pressure to find that perfect job or that right job. But the reality is that that's really not that's not what I see in practice with my colleagues. People move, people change, life changes. So don't stress about finding the perfect job. Find a job that fits what you need with where you are right now. And I do think that location does matter. And I think that, looking at what is your time off spectrum, how much time do you have between shifts or time, so that you also have a chance to be human and not just like surgeon on call, surgeon back up. So you got to have some time just to be human, to do whatever it is that you want to do. And that's, I think, an important part of avoiding burnout
Now, Serena,
is
are
to
you
have that time.
working kind of on the side as a coach, or do you offer advice, or are you just a friendly ear on the end of the phone to other physicians? How are you managing that?
Yeah, I do. I do coaching as well. I found it so incredibly valuable in my life, and as I started becoming more and more aware, when I first experienced, when I was going through burnout, honestly, I didn't quite recognize what it was initially, and then when I did, I thought, oh, this is a me problem, and I need to fix myself. And so there was a lot of isolation and shame in that whole journey, and I think finding coaching really changed my own narrative and my own experience of what burnout was and how do I overcome it. And then as I started to share more, I realized there's so many others who are either going through it, suffering silently, or they have gone through it and they've come to that space of, okay, this is what works in my life. And so a lot of what I do is really raising awareness, advocating, and providing tools and coaching to help with burnout, whether someone wants to do full-time practice, part-time practice, non-clinical career, or not do anything within medicine but do something else, whatever it might be. I coach on how to really create that intentional change. I'm a huge believer in habit building, time management, and
Mm.
productivity, which honestly came way before my whole coaching experience, because those were the things that really helped me stay sane in my full-time surgeon mom life. I think those tools are great, but no matter how awesome habits you have and how productive you are, I think the other aspect of coaching that I really enjoyed and have added to my life and for my clients is mindfulness and self-love and self-compassion. And how do you create that intentionality and living authentically? Like, all of those things are also important, and we want to balance both.
how would someone get in touch with you if they wanted to learn more?
Yeah, absolutely. They can so I have a podcast as well. It's called Mindfulness and Productivity Systems Podcast on iTunes and all of the major platforms, so they can do that. As well as I'm on social media, Instagram and Facebook. Facebook just under my name, Serene Shereef, and Instagram is Dr.Serene. So they can reach me through that.
Well, I think serene sounds like your mother knew what she was talking about, right? When
I
came
don't
up
know
with
about
that name.
that.
Well,
They were hopeful, let's just say. Apparently I was a very I was a very serene baby, but when I was, in utero, I was a pretty busy baby, so they were hoping I'd be more serene coming out.
Well, Dr. Serene Shereef, I want to thank you very much for joining me on the art of medicine.
Thank you.
Well, before we close, I'd like to give another thanks to our sponsor, locumstory.com, a resource where providers can get unbiased answers to all their questions about locum tenens. Thanks for joining me and see you next time. This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on the art of medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com